Alcalak is a medication used to treat symptoms caused by excessive stomach acid, such as heartburn, upset stomach, or indigestion. It works as an antacid by reducing the amount of acid in the stomach. It's important to check the ingredients on the label every time you use it, as the manufacturer may have changed the ingredients. Additionally, products with similar names may have different ingredients meant for different purposes, so taking the wrong product could be harmful. The recommended dosage for Alcalak is typically taken as needed for relief of symptoms, but it's important to follow the instructions on the label or as directed by your doctor. It's best to take Alcalak when you first start to feel symptoms or after a meal. When taking Alcalak, be sure to follow the instructions on the product packaging. If you're using the chewable form, make sure to chew the medication thoroughly before swallowing. If you're taking the liquid form, be sure to shake the bottle well before each dose. It's important not to exceed the maximum recommended dose stated on the product package. If you have any concerns or questions, it's best to consult with your doctor or pharmacist. If your condition persists or worsens, it's important to inform your doctor. Also, it's crucial not to take the maximum dose of the medication for more than 2 weeks unless directed by your doctor. If you suspect a serious medical issue, seek medical assistance immediately. Remember to always follow the recommended dosage and consult with a healthcare professional if you have any concerns about taking Alcalak. If you experience constipation, gas, or burping while taking Alcalak, it's important to let your doctor or pharmacist know. However, many people who use this medication do not experience any serious side effects. If you do notice any concerning symptoms, such as loss of appetite, nausea, unusual weight loss, bone or muscle pain, changes in mental/mood, headache, increased thirst or urination, unusual weakness or tiredness, or signs of kidney problems, it's important to inform your doctor right away. While a serious allergic reaction to Alcalak is rare, it's crucial to seek medical help immediately if you notice any symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. It's also important to note that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist for further guidance. As for the best time to take Alcalak, it's typically recommended to follow your doctor's instructions for dosage and timing. Be sure to discuss with your healthcare provider about the optimal timing for taking this medication. Before taking Alcalak, it's important to talk to your doctor or pharmacist if you have any allergies or if you have any health issues such as high calcium levels, stomach/intestinal blockage, or kidney disease. Some products may contain aspartame, so if you have phenylketonuria or any condition that requires you to restrict your intake of aspartame, make sure to consult your doctor or pharmacist before using this medication. If you are pregnant or breastfeeding, it's also important to consult your doctor before using Alcalak. As for the daily dosage, it is best to follow the instructions provided by your doctor or the directions on the product label. Typically, Alcalak is taken with food to help with the absorption of calcium. It is important to not take more than the recommended dose, and if you have any questions or concerns about the timing or dosage, make sure to talk to your healthcare provider. Drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. There are some products that may interact with Alcalak, such as digoxin, certain phosphate binders, phosphate supplements, and sodium polystyrene sulfonate. Calcium carbonate, the main ingredient in Alcalak, can also decrease the absorption of other drugs. This includes tetracycline antibiotics, bisphosphonates, iron, and levothyroxine, among others. It's important to separate your doses of these medications as far as possible from your doses of Alcalak, and to ask your doctor or pharmacist about how long you should wait between doses. Additionally, it's important to check the labels on all your prescription and non-prescription/herbal products, as they may contain calcium. Ask your pharmacist about using those products safely while taking Alcalak. If someone has taken too much Alcalak and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. You can call 911 or your local poison control center for assistance. Symptoms of an overdose may include nausea, vomiting, loss of appetite, changes in mental or mood, headache, weakness, and dizziness. It's important to keep all medical and lab appointments to monitor your progress with Alcalak. In addition to taking Alcalak, lifestyle changes can also help reduce heartburn and other stomach acid problems. This can include participating in stress reduction programs, quitting smoking, limiting alcohol intake, and making diet changes such as avoiding caffeine and certain spices. It's a good idea to talk to your doctor or pharmacist about lifestyle changes that might benefit you. Not applicable. When it comes to storing Alcalak, it's best to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom, and always remember to keep it out of reach of children and pets. When it comes to disposing of Alcalak, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, it's best to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.